You're watching our special focus tonight on private hospitals and public health. This at a time when private hospitals are bearing a major part of the burden of coronavirus cases across our big cities. Well, today, in fact, the Delhi's Health Minister, Satyendar Jain, had to be shifted to a private hospital after his condition worsened. He will apparently have plasma therapy at Max Saket. Earlier, the Haryana Health Minister was at Max Mohali for a hip fracture. Even health ministers, government doctors are all opting for treatment at private hospitals. Government hospitals for the masses, private hospitals for the privileged. Also now, home isolation ending in Delhi. More pressure on state facilities. Prices are also capped for private hospitals today. Justified or unrealistic? Let's listen to what Arvind Kejriwal said on Mr. Satyendar Jain's condition.
उनकी तबीयत थोड़ी सी आज उनका निमोनिया बढ़ गया. आज सिटी स्कैन उनका लेटेस्ट जो आया उसमें कम होने की बजाय निमोनिया के पैचेस जो उनके लंग्स में थे वो ज़्यादा बढ़ गए. सुबह से उनको थकान और ज़्यादा और गिडनेस बढ़ने लगी. तो अभी मेरी बात हुई थी उनसे तो अभी बातचीत चल रही है सभी डॉक्टर्स के साथ. वो भी डॉक्टर सलाह देंगे तो डॉक्टर्स की.
Well, joining us tonight on our special debate, I'm joined by Dr. Sandeep Budhiraja. Now, he's the Group Medical Director of Max Healthcare. I'm also joined by Dr. Sujit Chatterjee, the CEO of LH Hiranandani Hospital, Mumbai. I'm also joined by Raghav Chadda, MLA of AAP, and Dr. Rajbir Singh, Chief of Respiratory Diseases, Apollo Hospital, and Dr. D.S. Rana, Chairman of the Board of Management, Sir Gangaram Hospital. Dr. Sandeep Budhiraja, if I can go across to you, because of course, Delhi's Health Minister was today shifted to your hospital. I think the first question everyone wants to know is how's he doing? We all wish him the very best and a speedy recovery.
I think it's too early to comment. All I can say is he's been shifted for continuation of treatment. And in view of confidentiality of the patient, I would not like to comment more. We have formed a board of doctors from Max Hospital and from Maulana Azad Medical College, and collectively we are taking decision and we are hopeful his health over the next few days will improve.
Right, and I think we all hope that, we all pray for his speedy recovery. But just to ask Dr. Budhiraja, it's interesting because I've just been observing that Max seems to have emerged as a center where so many patients are being rushed, patients from the common man to VIPs, including where you had the government doctors are also coming to Max Hospital. We had the Haryana Health Minister in a Max Hospital in Mohali, Delhi's Health Minister. Why is it that government hospitals is not where government doctors or even public servants are going?
Well, I would not like to comment on the government part, but the first part of the question I would definitely like to address is, it's the three things which are important when we talk about disease management and something which is as complex as COVID management. It's the people, processes, and infrastructure. The easiest to replicate across is the infrastructure. You make a building and you put some equipment and instruments. That's not a big deal. I think the cutting edge comes in creating processes, in creating SOPs, and following those across the board and having the adequate and right technical manpower. Now, in ICUs, managing a complex ICU patient with COVID is a highly complex condition, and you need highly trained manpower. You need processes which work end to end. You need to have a complete critical care services from a patient who could be just on a non-invasive ventilator to a person who requires complete ventilation, a renal support, which we call CRRT, and sometimes the ultimate things called ECMO. So these, I think, are the differentiators.
I want to bring in Raghav Chadda here from AAP because I think, Raghav, I think one of the distinguishing factors of AAP and something which was all applauded was your focus on healthcare, affordable healthcare for the masses and affordable education for the masses, good quality education. Yet the irony is, and this is not just about one person, I don't want to make it about the health minister, the irony is that when we see something like the coronavirus, the issue is still that people rush to private hospitals because they feel government healthcare can't give them the same. This on a day when private hospitals' rates were actually capped.
Well, first of all, the entire focus of the Aam Aadmi Party in the last 5 years of our government was largely on primary healthcare setup, which comprises of mohalla clinics, dispensaries, so on and so forth, because that was the tier which was completely broken in Delhi. And we were gradually proceeding towards secondary and tertiary level care in Delhi. Now, of course, ever since this COVID outbreak has happened, this pandemic has hit us, both the government sector as well as the private sector hospitals are working in close coordination, and both of them have played a very significant role in ensuring that people in Delhi do get the best possible treatment. But of course, there are instances when a team of doctors decide that a particular sort of medical care is required for a patient, and wherever that care is available, that patient is shifted to that facility, and that is precisely the case with our health minister. Now, having said that, of course, a lot of videos as well as anecdotal evidences have come to fore that throw some light on certain mismanagement vis-a-vis the private hospitals, and as a result, the government of Delhi has, done the following. First of all, as you very well know, we've come out with a mobile application in which the availability of beds as well as, other important critical aspects of the infrastructure in a hospital is available on everybody's smartphone at a click of a button. The second, of course, we've installed LED boards outside every private hospital so that those who do not have access to smartphone can simply visit the reception of the hospital and see the availability of beds, pricing, so on and so forth. And thirdly, what we've done is that we have, put one medical officer from the government of Delhi at the premises of every private hospital.
I think those were well advertised when the AAP government announced that last week. But I just want to go across, because I find this dichotomy also interesting, and it's not just about Delhi. But if I can just go across to Dr. Raj Singh, who joins us from Apollo Hospital from Chennai as well, because Chennai is facing a similar worry. I'm sorry, we haven't got him yet, but Dr. Sujit Chatterjee of the Hiranandani Hospital, Mumbai. Now, we see similar scenarios playing out across cities where the state government and private hospitals, though meant to be in the same page, often clash on certain issues. Like, for instance, today there's a rule that the BMC says that asymptomatic patients cannot be admitted into private hospitals. It has to first go via a BMC control room. Is it at this point that we realize that this lack of coordination or the stress on the private health system, because the public healthcare system is not adequately equipped, is now leading to these issues where patients are getting stuck in between?
I don't think patients getting stuck in between, because there is intense coordination between the Bombay Municipal Corporation as well as the private hospitals. But that being said, the volumes in Mumbai, there are 2.2 crore people living in Mumbai, so the volumes are naturally very large, and the healthcare facilities are getting overwhelmed by the numbers which are coming in. But as my co-panelists have already said, that this is a very significant drive between the public and the private players together, and so we are batting as a team. So yes, there would be a certain amount of like you put it, dichotomy. But the fact of the matter is that we really are batting together. But yes, because the numbers are so large, you're going to have certain problems which come up, certain decisions which have to be changed for the betterment of the patient. But today, I can with certain and complete confidence say that the Bombay Municipal Corporation as well as the private players are all on the same page.
That's excellent to hear, and I'd like to bring in also Mr. D.S. Rana of the Board of Management of Sir Gangaram Hospital. Now, of course, we all had that the news last week when an FIR was filed against Gangaram Hospital by the government. That seems to have been sorted out now, so that's good news. But at times like this, what is the main focus that we need to look at, not just for dealing with this pandemic right now in a crisis, but how do we set systems into place where we don't have the issue that those who can pay for it would want to go to a private hospital, and it's only those who can't afford it will go to a government hospital, except of course in the case of the All India Institute of Medical Sciences?
Sonia, this is everybody has got right to use any hospital. What is very clear that private hospitals are paying hospital for majority of patients, except 10% obligation they have got towards EWS patients. But as far as this part is concerned, this is unexpected, unprecedented crisis of COVID disease, and middle class families, they are finding difficult to afford private health care, while they are not very much interested in going to government hospitals. For them, those who are covered by insurances or they are having small insurances, really a pain point for them. And they are the people, those who feel that probably hospitals are profiteering, which is not the true picture. On the other hand, people who can afford, they do not make any invoice, they very happily afford it, they happily pay it. As far as private hospital dailies are concerned, they have been charging money as per their usual charges, plus whatever COVID expenses are coming, And they were bearing from, say, somewhere 4,000 to maybe 5,000 to 10,000, because depending on various factors, there is very multifactorial cost of PP, so-called PP kit, I will say COVID care cost, So right now, I think now since the problem is getting increasing, so government is seeking the help of private hospitals also to pitch in. And we are all cooperating with the government, and we are trying to do whatever we can do. And
I want to just ask, I'll ask that question to everyone on the panel, but I want to get Raghav Chadda's view in on that. Now, we know Mumbai already did that of capping rates of private hospitals, but Raghav Chadda, at one point, what private hospitals argue is that you can't expect quality healthcare at the drop of a hat and then move into cap prices whenever the government feels like it. What do you think is the fair way out?
Look, I personally feel that in this outbreak, in this pandemic, where millions and millions of people require a good quality treatment, it is important to make it affordable. And the only way of making this affordable is there needs to be an active stakeholder consultation between the government and the private players. Now, I'm sure you are already aware of the fact that a committee was constituted under the chairmanship of Dr. V.K. Paul, a member of the Niti Aayog, by the MHA. He has already prepared a report. We are not privy to the report. The report hasn't been given either to the government of Delhi or has been put out in the public domain yet. It is likely to be presented in the SDMA tomorrow afternoon when the meeting takes place. But so therefore I can't comment on the numbers and the figures and the rationale that Dr. Paul's committee has arrived at. But I can certainly say that yes, it is important that we make it affordable at this point in time. I am not saying that every private hospital in the city is cheating the people or fleecing the people, but I'm certainly saying that there has been overwhelming evidence, if not anecdotal evidence, that goes to show that yes, there have been so many instances where private hospitals have fleeced the ordinary man, the common man, and as a result of which affordable healthcare hasn't been very affordable. So I think in times like this, all of us can come together and give away some amount of our profits and work towards ensuring that mankind receives the best possible care.
Is it about, let me bring in Dr. Raj P. Singh, joins us now from Apollo Hospitals, Chennai. Dr. Singh, one, of course, the point raised about at this time private hospitals can put away a bit of their profits, and also the larger point that the private hospitals seem to be emerging as preferred destinations for not just, as I said, people who can pay for it, but even for politicians, government doctors, etc. Why is it that private hospitals are still the first resort for those who are meant to be in public service and see what government hospitals are like, where the common man has to go to?
Good evening, everyone. I presume the need for capping private hospitals is that to prevent the profiteering of hospitals, those who are taking advantage of a national calamity like this to make an increase in profit. Now, that is certainly unacceptable, and I would certainly agree with all those who have spoken so far that profiteering in times of a pandemic is certainly not acceptable. Having said that, I think you have to remember that many hospitals who are accepting COVID cases are actually running at a loss, because these hospitals are not really meant to be COVID hospitals. These are hospitals which are providing a wide range of specialist services which have been put up at enormous cost. And right now, when these hospitals are accepting COVID cases, many of these expensive facilities are running unutilized or even underutilized. So these hospitals will have to incur some loss. And I think the corporate hospital, just like any other business or any other individual, would be prepared to accept a certain loss during this kind of national calamity. And I think as long as the losses are not unsustainable, they should be willing to accept such a loss. Now, capping, I think, introduces a few factors here. Now, the first is we need to cap at a reasonable figure. And how do you arrive at a reasonable figure, it is by accurately costing and auditing the hospital's intensive care units. And you may be surprised to find that actually the cost of an intensive care bed is actually quite expensive. And therefore, if you accept that even if you cap it at about, say, 50,000 rupees a day, when it easily can be more than 1 lakh a day in many of the corporate hospitals, even if you cap it at 50,000 a day, and if the patient undergoes treatment for 10 days, you're really looking at straight away an expense of 5 lakhs. Now, what percentage of the Indian population can afford this kind of 5 lakh for a 10-day care in hospital? I would think that maybe less than 3% of the Indian population. So we're really looking at the 3% of the Indian population who incidentally, well, it might include me also for that matter, but the 3% who have 5 times the wealth of the lower 70% of the population.
No, and
so
I
it
think
is this elite.
it's really the inequalities in our health system, the fact where 80% of our health care is in the private sector, which show up at a time like this. And perhaps that's where we look at addressing more fundamental issues. Dr. Budhiraja, I'll end with you because, of course, right now the focus is on private hospitals in Chennai, Delhi, Mumbai. What are your final thoughts, sir, on this? That sometimes private hospitals made the villains of the piece about profiteering. We saw the outrage on social media where those absolutely ridiculous rates had come up of Max Hospital in one of the branches. I don't know which it was or even if it was genuine. But how would you answer people who, or say the AAP MLA Raghav Chadha, who says that this shouldn't be about profiteering?
In times like this, I think private healthcare, especially Max Healthcare, has partnered, walked shoulder to shoulder with government. I think we will go all out to support government and support this country in this crisis period. There is absolutely no way private healthcare is profiteering. In fact, most of the private healthcare at this time is running in losses. One is able to sustain this period, one wants to support the people, and I think we'll go all out for that. In terms of certain adverse publicity about billing and all, I think it's the way you interpret. Has the cost of care per bed in a government hospital in an ICU ever been calculated? Now, just about 2 days back, I was attending one webinar where one very esteemed speaker said that about 10 years back, a calculation was made as maybe for, I think, an institute like AIMS as to how much is the cost of care per bed in an ICU, and the figure at that time was quoted something like 60,000. Now, I do not have that report with me. This is one of the speakers who spoke on webinar. So I'm just trying to say that one really needs to sit on table, estimate and calculate the cost of care, and then we should have these logical discussions. But in terms like this, I think private healthcare, corporate healthcare will completely shoulder and partner with the government agencies and with the citizens of the country.
Right. Well, thank you all very much for joining me. As I said, the debate on private hospitals and public health is one where we should look at what about fixing our public health systems really key. As I said, it's even our health ministers of different states are going to private hospitals, showing a larger problem in the entire system. Thank you all very much for joining.